Last week, I have received a message from one medical coder. So basically, he is planning to learn medical coding, but he don't know how to code pregnancy complications using ICD-10 CM. So he kept one message stating that, "Sir, I want to learn coding of ICD-10 CM pregnancy complications." Hence, in order to help that coder, I am creating this video. If you are also having any problem with any topic in medical coding, please mention in the comment section of this video. I will create one video related to your complicated topic. So today's our topic is ICD-10 pregnancy complication coding. So before going to learn pregnancy complications, we need to understand few terminology related to this chapter. So first we will learn few terminology, not much, very few. Most of the time in the documentation we will see GP like G2, P0, but most of the coders don't know what is the meaning of G and what is the meaning of P. So here G for gravida. So gravida means number of times someone is or has been pregnant regardless of the pregnancy outcome. Teen pregnancy is counted as 1. So basically G means gravida, means how many times patient is pregnant irrespective of whether patient has delivered or not. So it will call it as gravida. Next we are having P. So P is for para. Number of pregnancies reaching viable gestational age, like it is more than 20 weeks. For example, we are having G2 P0. So here what is the meaning of G2 P0 here? So patient had two pregnancies but neither survived gestational age of greater than 20 weeks. So here 2 remembers or 2 denotes 2 times pregnant. Here along with P this 0 denotes, so patient does not have survived pregnancy after 20 weeks gestation. Next we need to understand multigravida. So pregnant more than one time is called as multigravida. Next we need to understand elderly gravida. So pregnancy for a female is 35 years or older at the expected date of delivery. So most of the time this elderly gravida is having high risk pregnancy. So in the operative report or in the documentation if we see patient is pregnant, if her age is greater than 35 years, we need to code one separate code for elderly gravida which we are going to learn soon. Next is antepartum, the period of pregnancy from conception to childbirth. Okay. Peripartum, the period involving the last month of pregnancy to 5 months postpartum. So basically postpartum is after the pregnancy. Okay. So postpartum, the period begins right after delivery and including next 6 weeks. Okay. So just you need to understand peripartum is different, postpartum is different here. Peripartum is 5 months postpartum. Postpartum is after delivery next 6 weeks. Next puerperium. So the clinical term for the postpartum period is otherwise called as puerperium. Always my intention is to help the medical coders as much as possible to provide knowledge sharing. If you are visiting for the first time, please click on subscribe button, and also if you like this session after watching, please click on like button. So in this session we are going to see 3 scenarios related to pregnancy complications. First one is bladder abscess in pregnant patient at 25 weeks of gestation. So here we need to code 3 codes. First one is from chapter 15, which is O23.12 for infection of bladder in pregnancy second trimester. So as we are having 3 trimesters, 1 to 14 one trimester, 14 to 28 second trimester, and 28 to until delivery third trimester. So here based on documentation we are having 25 weeks of gestation. So 25 weeks means it will comes under second trimester. Okay. Next, for bladder abscess, you need to code normal code, and you need to code weeks of gestation also along with this chapter 15 code if the patient is having pregnant complication. Basically, the leading for this is very easy. Directly you will go to pregnancy. Okay. Under pregnancy, you need to check for complication or complicated by. Okay. So if you see here, pregnancy is the main term. Under pregnancy, we need to check complicated by. Okay. Next, we need to check for abscess. So where is the abscess here? So here. So patient is having the bladder abscess, correct? So we need to code bladder. O231, and for fifth character, you need to check based on your documentation. And also for other cystitis without hematuria, you need to use N30.80. This you will get directly using the index. So your main word is here cystitis. So we'll see next scenario. So the patient at 38 weeks admitted for delivery for twin pregnancy. So for this scenario also, your primary or main term is pregnancy. Under pregnancy, you need to find twin. See here. So our primary term or main term is pregnancy, and our subterm is twin. So as patient is having twin pregnancy, and we need to choose any one among these codes based on our documentation. So based on our documentation, patient is having twin pregnancy, dichorionic, diamniotic third trimester. So if you see here, under pregnancy, under twin, we are having dichorionic, diamniotic 030.04, here 3 for third trimester. And also as we have learned previously, if the patient is greater than 35 years, we need to code one separate code for high risk pregnancy. But in our scenario, patient's age is not mentioned, we no need to worry. But if you see the patient age in the operative report, you need to code for separate code for high risk pregnancy. So here we need to code for weeks of gestation, which is 38 weeks. And also we need to code for L live bar twins at 37.2. If anyone looking for APC's local chapter free webinar links for free CUs, medical coding jobs in India, USA, UAE, join in our WhatsApp group. Group link is in the description of this video. So here is the fastcoder 21 YT WhatsApp link. So you can join using this link if you are looking for free APC CUs as well as jobs in India, USA and UAE. And also anyone looking for same day surgery training, IVR training, cardiothoracic training, you can send WhatsApp message to 707-526-3939. And we will see third scenario. Say 36-year-old G2P2 20 weeks pregnant seen for gestational hypertension. She did not have any other problems. Here our principal diagnosis will be gestational hypertension without proteinuria second trimester. Why means 26 weeks comes under second trimester only. And here patient is having gestational hypertension. So gestational hypertension means patient is having the hypertension during the pregnancy. So gestational hypertension is separate and pre-existing hypertension is separate. If the patient is having hypertension before the pregnancy, we will call it as pre-existing hypertension. But in the report they have mentioned which is due to pregnancy. So gestational hypertension. And also as we have discussed previously, you need to code O09.522 for supervision of high risk elderly multigravida second trimester. Okay. So my means patient is 36-year-old. So we have discussed if the patient is greater than 35 years old, we need to code this add-on code or separate code. And also we need to code 26 weeks or Z3A.26 for 26 weeks gestational. So thank you team. So thanks for visiting our channel. If anyone looking for same day surgery coding training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button in order to motivate me to provide more videos like this. And if you want to learn something new, please mention in the comment section so that I will create one video related to that topic. If you are visiting for the first time, please click on subscribe button.